Hello and welcome to this webinar on Bachelor of Audio and Speech Language Pathology, the first webinar of this year. Good evening, everyone. I'm your moderator, Preeta Harikrishnan, Deputy Manager Admissions at Amrita Health Sciences, Kochi campus. Thank you for taking the time to join us today for a session on this webinar. To ensure we are addressing your queries in the best possible way, please feel free to use the chat box to send your questions through the session. Now I'm pleased to introduce a special guest, Gayatri Ma'am, Assistant Professor, Department of Audiology and Speech Language Pathology at Amrita Institute of Medical Sciences, Kochi. Gayatri Ma'am holds a Master's in Audiology and Speech Language Pathology from the School of Allied Health Sciences, Kasturba Hospital, Manipal. She has taken on several important roles, including serving as a question paper setter for the B.ASLP program, as well as an internal Viva examiner and theory evaluation examiner. Apart from her clinical expertise as a speech language pathologist and audiologist, she has also been an active participant in numerous national and international seminars related to audiology and speech therapy. Her contributions to the field include scientific paper presentations, poster presentations, and various publications. We are honored to have her here today to give us valuable insights into the world of audiology and speech language pathology. A warm welcome to you, Gayatri ma'am. We look forward to hearing from you. Welcome.
Thank you so much for the introduction. So, my topic of presentation, or I'd be dealing with the scope and career prospects in B.ASLP. So, first, let me introduce the regarding the course. I'll give you base idea what is B.ASLP, or in elaboration, which is Bachelor in Audiology and Speech Language Pathology. So it's basically a 4-year undergraduate course in India, which is designed to provide students with concerns or in-depth knowledge regarding the area of audiology and speech language pathology. So when it comes to audiology, it include the assessment, diagnosis, and management of um, audiology related, that is hearing and balance disorders, where we would be dealing with um, uh, the wide variety of population that includes children, adults, and older adults. And when it comes to speech language pathology, it mainly deals with the communication disorders, that is basically concerning the speech and language, where you would come across with various disorders like stuttering, cleft lip and palate, cerebral palsy, or when it comes to adults, you would be dealing with the adults who has lost their speech and language post stroke, or after um, a road accident or a brain injury, like that. So you'd be assessing them and giving therapy in order to develop, or in order to enhance their speech and language skills and to bring them back into their life. So basically, it focuses on the study of anatomy and physiology of ear, nose, and throat, which where it would be dealing with and how these speech and language disorders are related to them. That is the anatomy and physiology, basically looking more or focused more into speech and language disorders that are related to ear, nose, and throat. So this course would provide the students with theoretical knowledge as well as practical training, which would be necessary for them to become a qualified speech language pathologist and an audiologist. So it would include training in communication, psychology, linguistics, neurology, research, electronics, and anatomy. And they would be learning to conduct detailed assessment of speech and language communication skills, to diagnose disorders, and to develop treatment plans according to the diagnosis. So the admission process for BSLP courses would vary from institution to institution. So the regarding the admission procedures in Amrita would be dealt further after my presentation. So basically, this course curriculum or the courses BSLP course is divided into 8 semesters, where the theory would be regarded to the 6 semesters, and the last, that is the final 2 semesters, would be basically focusing on the practical training, which is an internship period. So it's just a 6 semester academic what do you say academic program with 2 semester internship program. So after the course, this you can after BSLP, you can have the opportunity to practice the skills in laboratory and clinical settings, as well as you can choose or the students have the opportunity to specialize in particular field. It's not just sticking on to one profession, because with BSLP you can choose whatever whatever what is your area of interest. You can go accordingly. That is, the specialization would be including the, you can go to neuro audiology, or you can if you are more into children, you can go into pediatric audiology, or if you are more into management or treating the person with hearing disorder, you can move into rehabilitative audiology part, or you can be an audiologist in a cochlear implantation unit, or when comes when coming into speech language pathology part, you can work in school as an SLP. And you can even teach in medical college. You can work as an assistant professor or lecturer, or simply you can work as an audiologist or speech language pathologist. So the opportunities after the completion of the program is just a vast thing. And after successful completion of BSLP program, you can even choose higher studies, like you can even go for master's program, or you can take a doctoral degree in the concerned field as well. So the main advantage of picking up this course is the scope of diverse opportunities, as I've already mentioned. That is, you are not sticking on to just a speech language pathologist or just an audiologist. You can, what you say, the student can take their opportunity to dig into more, and they can create their own interest into whichever area. That is, the area of setup as well as the specialization would be diverse. That is, you can work in a hospital, you can work in a clinic, you can work in a rehabilitation center, you can work in a school, you can work in a private clinical practice setup. And if not at all, this is not working, you can even start your own clinic, and you can be an entrepreneur as well. So the this is what is the most interesting or the attracting fact about the BSLP course. That is, it provides multiple or diverse opportunities in the career. So um, the key career paths which I would be more flourished into after BSLP would be the speech language pathologist. That is, they can work in a any setup, that is in a medical college, or like Amrita, or in a private clinical practice setup, or in a clinic. Where they would more deal with different age groups, where they would deal with more communication, articulation, voice, language, fluency disorders. And even they can work as an audiologist, as like they can provide rehabilitation services, cochlear implant units, like that. And even they can work as a clinical supervisor. That is, they can be a mentor in clinical settings that would be mentoring this speech language pathologist, and they can even work as a researcher. That is, they can conduct various studies and research regarding this field, that is speech and language disorders. They can develop new assessment tools, treatment techniques, so they can work as a full-time clinical researcher as well. uh, and also they can deal with the swallowing part as well, so they can be a swallowing pathologist, which would be dealing with swallowing disorders and people with just having swallowing difficulties. Okay, so the next question from your side would be why or what how this BSLP would become a good career, right? So the first thing is that the first reason for being chosen for the BSLP course is that it's growing need. That is, especially this post COVID, many cases are reporting that is after COVID, they are having this hearing disorders, speech and language disorders. That is most basically when you come into children, most of them would be during the COVID time, they would be at home watching TV because they have nothing to do other than that. They can't come out of the house, they can't explore the other activities around the world. So they would be just sitting at home, and they would be having maximum exploration to TV, mobile phone, etc., which would further resulting in their poor speech and language development. They would be having a delay in speech and language development. So that is a very drastic increase that has happened post COVID. When it comes to adult, this COVID, after COVID, there are many studies, and also there are many cases which I have witnessed, where they have developed this hearing loss or hearing problems or just balance issues, etc. So the need for this professionals is being increased in the world. So no matter what, after this course, this is a guarantee that none of them would be unemployed, because since the demands or the needs is being increased from the society, from the world, you would be placed at a good position. Okay, and then the next thing why BSLP is because of its diverse work setting condition. As I've already mentioned, that is, you can choose in what setting you want to work. That is, if you want to work in a medical college setup, or else whether you want to work in a private clinical practice, or whether you want to work in a research oriented setup, or you want to work in a cochlear implantation unit, or you want to work in a school setup, or else you want to put up your own clinic. So there are many diverse work setting options where you could choose depending on your priorities, depending on your interests, like that. And then moreover, the other reason would be it is creating a positive impact in someone's life. That is, even for the people who have this speech language hearing disorder, you are creating, or you are bringing what you say, you are bringing a new life to them, by making them speak, by making them hear, by making them communicate with people. So you are creating a positive impact to the society, to the people. So that itself is the biggest reason for being a good career option, why this BSLP become a good career scope or good career option. And then that is, the next reason would be the global opportunities. That is, it's not only demanded in India, but also you can get job abroad, because the demand or the career scope is not limited just in India. So this internationally also, particularly in research and clinical settings, internationally also it has wide variety of opportunities. And regarding the salary and growth, since the demand or the need in the society is very high, the BSLP professionals are getting a good salary in and around India as well as outside India. And also, it's a recession proof career. That is, you would have heard recently this, especially after COVID, most of them have faced recession, especially in Gulf countries, in UAE and all, especially in the field of IT engineering and all. They would be just what you say, once like on a good day they will be send off from their job without any notice. So this course, that is a BSLP course, would never face such job shortages or such recession, because since it is a health professional, as far as people are concerned, or people are having difficulties with hearing and speech and language disorders, BSLP professionals or BSLP career would exist here. Okay. So since that would be itself the potential challenges to consider also. That is, because of this increased needs and demands, the competition in this field is also increasing every year. That is, depending on the location, depending on the need, depending on the population, the competition of the jobs increases due to increased number of BSLP graduates. So, in order to assist, or in order to what you say, in order to flourish in the field, you have to have certain specialization. That is, you can have a specialization in any particular field, so that you can have that also aids in the salary. That is, specialization, experience, everything would aid in the salary also. So it's not a biggest potential challenges, but some of the challenges you can consider um, when you choose this career option. So, and the last, but the most important question would be, why Amrita, or why you should choose Amrita. So there are multiple reasons why you have to be in a what you say, in a very well established medical college setup like Amrita, because the first reason being the reputation for the academic excellence. That is, I can proudly say that being an alumni of Amrita, I did my bachelor's here. So wherever I go, the reputation of this Amrita is being very high. That is, when I say that I am an alumni of Amrita, that representation itself is very much, that is, they know how Amrita would treat, or how Amrita would, treat patients as well as students, because um, the clinical exposure here is very tremendous. That is, since it is a well equipped hospital, the we can expect a high diversity of caseloads, different variety of cases, be it a neurological, be it any other causes, any kind of cases you can experience, and you can have this hands-on clinical experience from Amrita. And also, this aims would provide you more research opportunities, because since we are finding, or we are witnessing new cases here, you can have this as an or you can take this as an research opportunities, and you can bring up your own tool, or you can bring up you can publish papers, you can flourish this research field in a very well way. And the Amrita University is consistently ranked among the top private universities in India, and this provides a good world-class healthcare. And also, the Amrita Hospital is a university teaching hospital, which was the first in India to receive NABH accreditation. And this has advanced medical and surgical practices. Also, it has specialized, or especially being a BSLP professional, you have to have this multidisciplinary approach. That is, you have to have referrals from different departments. So that would be provided in Amrita. That is, you can have referrals from pediatrics, you can have referral from geriatric, you can have referral from neurology, psychology, oncology, radiology. Every department would be having this referral. So it would be a multi disciplinary team approach that would be what do you say, that would be provided by Amrita. And also, uh, people think that after completion of BSLP course, you can only deal with or you can treat hearing and speech issues in the disabled, but the scope is not limited to this only. That is, they can also work in an NGO, they can work in a corporate private hospital while playing the same role. And also, if you are, that is, if we work in a particular, if we work in a same setup or same setting for a long period of time, we might get bored. So you cannot, you have not, you need not change your career, you need not change your profession, rather you can change the setting or the work setting, you can change, that is the work population you can change. Sometimes if someone is interested more into children, but other one is more interested in old age population, you can switch accordingly where you have to work on. That is, that person can work at old age care, or the person who is interested in more in child cases or pediatric care, they can work in this child care center respectively. And the most interesting thing is that you can start your own clinic. You can be an entrepreneur. Moreover, it's not the peculiarity or the most, the good thing about this career is that you need not to be work under someone. You can be your as an independent professional. You can be a consultant. That is what is making you independent in your job, personally as well as professionally. So you can make your own decisions, you can send referrals, you can work on a patient's with your own, uh, what is right. You can make a decision regarding what is right for this patient. So none of no one else would come and interfere in your professional setup. So this is basically what BSLP is offering you, is an it's complete independent job opportunities or the career objectives which would be looking forward. So yeah, that's all about the scope and the um, career prospects of BSLP. Yeah, thank you for listening. Good day.
Thank you, ma'am, for that. Ma'am, we got a very good explanation on why, what is BSLP actually. So let me
Yeah.
just ask you one question, ma'am, for the students on the whole. Like, what should be the attitude or what should be the mindset when they come uh, to join BSLP course in Amrita? So what should they really make up their mind? We heard a lot. They have a lot of opportunities, but when they come to attend the first year of their BSLP classes, what should be the mindset of these students? What is the
So
attitude they have to keep?
yeah, so since it is a medical professional, you have to deal with people. You have to deal with their life. So you have to be very empathetic. That is, you know you don't you should not have the sympathy. You have this empathetic nature, that is, make them believe, that make them think that you are there for any help regarding the issues related to speech, hearing, and language. So when you join in the first when you join as a newbie or fresher, it takes time to cope up, or it's take time to understand the environment, understand the setup. So once you get to know, or once you get a clear idea of the setup, you would never go back, because the environment or the infrastructure is in such a way. So you would be seeing new patients, you would be seeing the smiles in them, which is very rewarding. From my personal experience, that is when a child speaks her first word through you, that itself would be rewarding for a lifetime. Or when a child is hearing for the first time using a hearing aid or a cochlear implant, which would be very rewarding. You would have seen many videos like the child hearing for the first time using a cochlear implant or hearing loss. So that video would definitely made you happy. So imagine how happier would you be if you are playing a role in that child's life. So your attitude would be like, you would be very patient, because you would be getting very vast variety of patients. Some might be arrogant, some might be very sensitive, some might be very short tempered. So you have to deal with all those emotions. So you have to be empathetic, you have to be very patient, you have to be a very good listener. Because most of the time when you seek a medical professional, that's when the people would open up their mind completely. Okay, so you have to see them like that way. You have to be a good counselor. Yeah.
So that means like they have to be like a doctor, a mother, or parent, or sister, or brother. Everything comes together to them.
Yes,
And
yes.
especially, are they like handling more of children or adults?
In Amrita, or basically.
No, when they come to this course, like they'll be having like postings or something
Yeah,
like that.
there are different population. There would
Okay.
be children, there would be adults, there would be old age people. So the age groups are from 0 to infinity. I mean, till
Okay.
the old age.
Okay. So that's ma'am. I see a few questions over here from the candidates, but
Yeah.
let me just. Is it a tough course? There is someone who's asking us. Is it a tough course?
um Tough, it would completely depend on you, how much effort you put on to, because it's not when you come for a professional course after your plus 2, the academic curriculum or the academic structuring or the way you would be teach or taught would be entirely different. Because till plus 2 you would be getting this and all books, you would be getting notes, or you would be getting stuffs like that. So you just have to refer to them, or you can have tuitions, etc. But when you go for a professional course, it's like half of the efforts should be put by you only. That is whether to you may find a huge central library here, where they have many books, so you can refer by your own. You will be getting what all to refer. Okay, so you have to make a effort from your side. If you are into this anatomy, physiology, that is basically biology, little physics, um, yeah, then you would survive. And it's completely like more than theory. You should learn the practical experience, or you should get the practical experiences. Because it's not just something that should be studied by heart. Um, there would be some theories and all which should be studied by heart, but this practical experience or hands-on experience or clinical experience you should learn by taking up more cases and all. Okay, so this um, um, what you say passing each semester would be easy, but you have to question yourself that you are whether you are able to take a case, or you are able to take a case alone in order to assess them, or to make diagnosis, or or give treatment for them. So it's more of clinical experience what you have to gain from the course, rather than this theory that or bookish, etc. You have to learn from books, or you have to have some theoretical knowledge, but more than that, you have to have this practical or clinical experiences. Yeah.
Mm. Ma'am, like for the first year, what are the subjects? Some of the subjects that they will have to learn.
um for the first year, it would change in the next academic year, but since now we have been following with the subjects like anatomy and physiology of ear, um, psychology, neurology, electronics. Since you're dealing with hearing aids and all, some sort of electronics, and then the communication sciences, that would be mainly focusing on to the aspects which comes under speech, language, and hearing.
Okay. So thank you so much, ma'am, for
Yeah,
enlightening us with your expertise on the field of audiology and speech language pathology.
yeah.
Now, maybe you'll have to wait a little more time because maybe we'll have some more doubts.
Sure,
Ma'am,
sure.
are you okay with that?
Yeah, sure, sure.
Okay. So before we wind up, we have Shandy from admission. So will talk to us about the whole admission process, and maybe there will be doubts the students have regarding the entrance exam that they have to write, and she'll be giving you more information on that. Shanley, welcome.
Thank you, ma'am. I'm Shanley from Admission Office Kochi campus. I'm here to explain the admission procedure for the year 2025. So in Amrita, we are offering 17 allied health science courses and B.ASLP is one among that. So the duration of the B.ASLP course is 3 year plus 1 year compulsory internship. And the students should secure a decent rank in the AEL examination, and also there will be an interview. The minimum eligibility is 17 years of age and maximum 23 years of age on or before December 2025. And in plus 2, the candidate should be having a minimum of 60 percentage aggregate marks in physics, chemistry, and biology. So, going to the fee structure, in the first year fee structure, the tuition fees for the B.ASLP in scholarship category it is rupees 1,80,000, and in non-scholarship category it is 2,60,000, and in NRI category it is $5,500. And we have also another fees of rupees 39,600 and an admission processing charge of 2,500. The hostel and mess fees for the first year it is rupees 80,000. So the admission is purely based on Amrita entrance examination, life science, agriculture, and medical sciences. So the examination date tentatively it will be the third week of May 2025. Mostly the exam is conducted in 3 slots in which the candidate can prefer any one of the slot. So each candidate will have exam at any one of the slots selected by the candidate. The slot booking will be opened in advance before the date of examination. And once after booking your slot, the candidate can download the admit card. So the question paper basically it will consist of 4 subjects: physics, chemistry, biology, and English, and the duration will be 2 hours. In physics, chemistry, and biology, you'll be having 25 questions each. And in English, 5 questions. The total number of questions will be 80, and 3 marks will be awarded for each correct answer, and -1 for each wrong answer. The examination will be conducted in computer based test mode, where a candidate has to answer the question based on the answer suggested as option. The entire syllabus and the information handbook is shared in the website. Please take a note on the website. It is amrita.edu/admissions/AEL. So all the details regarding the entrance examination is getting updated in the website. So the candidates are strictly instructed to go through the website for all the updates regarding the entrance allotment details. So take a note of the website and the portal also. The website of Amrita, it is amrita.edu/admissions, and the exam website it is amrita.edu/admissions and /AEL. The portal for registration it is www.applyug.amrita.edu. This is the only portal to apply for any UG programs other than BTech offered by Amrita Vishwavidyapitham. So, once you register using applyug.amrita.edu, you'll be taken to this page where the first step is registration. You have to register using your mail ID and you have to enter the personal informations including photographs and signature. And further moving, you'll be taken to this particular page where in the left side, the campus of Amrita will be shown and in right side, the corresponding courses will be shown. So coming to B.ASLP, we are providing B.ASLP in Kochi campus. So here you can see the option. You can select Kochi campus and you can select B.ASLP and click on the apply button. So once you apply for the B.ASLP, and in my application, you'll be having options to select the city preferences for the computer based test. You can give up to 3 preferences, and below that, whatever courses you have applied, the summary of the courses applied will be shown here, and you can proceed. So before doing the payment, finally they'll show the preferences which you have entered. If at all you want to change the preference, you can go back to the previous step and you can change the preference, or else if it is confirmed, you can proceed for the payment. There is a registration fee of rupees 550 and the amount can be paid using multiple options. So once after paying the registration fees, the next step is entering the academic details where you can enter the branch or group which you're going in plus two and the 10 percentage marks, the board plus two board, 12th standard state, year of passing. Suppose currently if you're doing your plus two, year of passing will be 2025, where your results will be awaiting. So you can select the option awaiting. Suppose if the candidate already completed the plus two in 2024, their result is already published. Suppose if you're clicking published here, there will be a provision of entering the marks of physics, chemistry, and biology and the total percentage of plus two. That also you have to enter. And the school studied. If at all your school is not listed in the program, you can select an option of others and you can enter the school name. Save and proceed to the next step. And this is the final step of the admission procedure, registration process, where you can upload the documents. Since if the candidate is attending plus two in 2025, certain document listed here won't be available. So in that case, you can upload the documents whatever you have currently with you. Like for example, SSLC will be there, Aadhaar card will be there, birth certificate will be there. So as of now, upload those documents and remaining documents you have to upload whenever you get it. So after completing all the stages of registration, the candidate will be receiving a confirmation mail including your registration number. For example, the registration number will be starting with 25. So save your registration number, registered mail ID and password for the future reference. So the portal applyug.amrita.edu should be remembered and also your registered mail ID and password should be remembered. And if you have any further doubts regarding the admission procedure, you can call to these numbers. These numbers are already displayed in Amrita website. And if any further queries there, you can send mail to ugadmissions@aims.amrita.edu. Please note that Amrita Vishwavidyapitham has not appointed any agent or third party client for securing admission in any program. Students are hereby requested to contact only the toll free number on our website for any admission related queries. Thank you.
Thank you, Shanley, for that detailed simplification of the whole process of admission.
Thank you, ma'am.
And candidate, like all the candidates who have registered and are here attending this webinar today, you will have the next webinar on the 21st of March. So you'll have to just check your mail and also your WhatsApp, and you'll be getting details over there. So I think, is there any more doubts that you have? And so that our guest, madam, could answer those. Anything more from your side? Any attendees who want to ask any more questions? There are some questions asking how to crack AEL exam. Of course, that depends on how well you have prepared for your plus two exams and how well you're studying your plus two subjects, physics, chemistry, and biology. That is only one, the three subjects that would be asked for your AEL exam. So please prepare on that very well. All objective type questions. You already got to know from Shanley that the questions, if you answer it correct, you'll be getting 3 marks. And if you're answering it wrong, there'll be minus of 1 mark. So get ready, set, go. Saturdays and Sundays, you have all the test papers based on AEL. You could attend that. You could get to know how these you have to do with these questions. And I think, ma'am, I don't see any more questions or doubts from the side of the students. There is one question asking, when I entered my ICSE board result, I couldn't enter. What should I do? Shanley, is there any answer you could give that student?
Yes, ma'am.
When I entered my ICSE board result, I couldn't enter. What should I do?
The candidate can send the query mail to UG admissions. We'll look on to that.
Yes. And
Thank
there is another question asking how to choose the date for AL exam. Now you don't have to choose the date. It will be already decided by, it's already decided by directory. They'll be giving you the information through your mail and WhatsApp. Please check through that. So I think Madam has been waiting too long. She has given us a lot of her precious time. And I thank you once again, ma'am, for being with us even this year. Even last year we had you. And I am glad that there have been a lot of them attending today's webinar and their doubts have been clarified. So as we come to the end of this webinar today, I hope you all enjoyed this whole session, and I hope to see you all soon in the Amrita campus. So take care and goodbye. Let us wind up this webinar for today. Thank you, ma'am. Thank you, all
Thank
the
you.
members who are there with us today.
Thank you.